Hey there, this is Luis Moreno. We are going to talk about doing quotes on HealthSherpa and also how to pair it with the Heartland's Hospital Indemnity. Now, I worked on one last night, and it's a pretty easy sell. So I want to kind of go over it because I've done it twice at two meetings, and it may have not stuck in your mind on how to do it, how to quote it, and how to pair it. So just to give you an idea, first, the screen you're looking at right now, this is healthcare, or this is HealthSherpa, okay? On here, when you're gonna start running quotes, well, first of all, a couple of things. Make sure that your NPN is here and your name. If it's not there, you need to check with HealthSherpa and get your name on here. Also, if you've got a logo, you wanna put your logo on here on the left-hand side. So make sure HealthSherpa does that. Now, when you get in here and you run a quote, you're going to go to your dashboard. And here are some of my existing customers. This is the one that I worked on last night. You'll have your customer's information here. Now, when you're going to run a quote, you're going to click on the quote button up here on the top right. Okay. Just as a reminder, here are the people that you're going to need to insure. Here is the tax family. Not the real family, but the tax family. So I'll run a quote for somebody here in San Antonio, 35-year-old female. I'm gonna say she's single. She's got a family of one, and let's say her income is $15,000. Okay, on the top right, just so you can remember, you've got, this is the savings. This is how much she's gonna get in assistance. Because of her income, she's also gonna get cost sharing reduction. And what this is it's going to lower her deductible, her out-of-pocket, her co-insurance, and her copays. So, and it's going to, the software itself will take care of calculating what those changes are going to be, okay? Then what I'm going to do is I'm going to click on silver. You're always going to try to default to silver. And then you've got your rates. So right now, I'm quoting 2020 rates. If you look here, it says plan year 2020. Yesterday, this lady lost insurance, so I quoted her a 2019 plan, which, just FYI, 2019 plans are a little higher, I believe. No, not in this case. So it's 19 for 2019, 2020. Let's see, what is the plan? That same plan is 25, so a little bit higher. Okay, anyway, so here's the plan. You can compare a couple and put them side by side. But on this one, just so you know, here's their premium. Here is their deductible. Here's their out-of-pocket. In this one scenario, the deductible equals the out-of-pocket. Pretty easy, okay? Her drugs or her doctors are free. Generic drugs are free. If I wanted to get some more details of the plan, which is, this is what you're going to want to do when you're with a customer. You'll click on benefits. You'll see this window here. And these are a few of the things that I go over. I'll discuss the deductible with them. I'll let them know that this is what they've got to pay first before the insurance pays anything. Then we'll get into the out-of-pocket. Well, in this scenario, it's pretty easy. The deductible equals the out-of-pocket. Do I need a referral? No, this is an EPO. I'll go over their copays for primary care visit, which is there's no charge. The specialist is $5 a visit. Deductible does not apply. Preventative care, screening, immunizations are no charge. Then here, this is important. A lot of people just focus on, oh, there's no charge. But you've got to realize this is no charge after the deductible. So in this scenario, diagnostic testing, imaging, which is your CAT scans and your MRIs, there is going to be no charge after you've paid that deductible of $675. Here's my generic drugs, no charge. Preferred are going to be $25 copay. My tier 3s and my tier 4s, there's no charge. But again, after the deductible. The facility fee, no charge after deductible. This is if they have outpatient surgery. Physicians and surgeon fees, no charge after the deductible. If you need immediate medical attention, you go to the emergency room, again, no charge after deductible. Your ambulance, no charge after deductible. Urgent care is $10. Facility fee, if you're in the hospital, again, no charge after deductible. So guys, you just kind of follow this, okay? I usually at this point, I stop there. If it's a female, I'll go over the portion if they're pregnant. And I'll go over some of this. And then I will go over what is not covered. So I'll tell them some of these items here are not covered, or these items are not covered. And then I'm pretty much done. If all else is good, my next step, I can go in here and check doctors. I can check their medications here. It's pretty simple. Now let's assume that they want this plan. Okay. I haven't told them the rate yet. Remember, we're packaging. Okay. In my mind, I already know dental costs $40. The vision is about $8, but I need to figure out what their hospital indemnity is going to cost. Okay. So I'll open up Heartland National. I'm going to log in. I'm going to go to support, secure flex, e-app. I'm going to put the person's name. She is 35, so she's born in 1984. I'm going to select the lowest amount, $100. I'm going to select for 3 days. The reason I like using 3 days, first of all, that's the least payable, the least number of days that I can choose. And also, it happens to be the average hospital state. I'm going to choose a state, Texas. No household discount because it's just her. Now, if she does live with anybody that is 18 or over, it can be a son, it can be a cousin, aunt, friend, whatever. Anybody 18 and over, they'll get this discount. I'll run the quote. Now, there's two things. Remember, in this scenario, she has got an out-of-pocket of $675. For a lot of people, they don't have this money. So what I'll tell them is, you know what, we'll indemnify you for this. In other words, when you go to the hospital, we're going to give you money to pay this $675. Heartland has a plan. So I'm going to put a daily benefit of $100. I'm going to do 3 days. Then I'm going to go to the hospital confinement and I'm going to add $500. So I've just added $11 of premium to this person. Now, I'm not going to make a lot of money, but I'm going to indemnify them. When they go to the hospital, day one, now a day is considered 24 hours. They're going to get $500, and then they're also going to get $100. In day two, they'll get another 100. In day three, they'll get another 100. So they could get potentially $800 from this plan. Now, I'm not going to leave money on the table. I'm going to talk to them about cancer. So lump sum cancer, I'm going to add 10 grand. I'm going to throw it in there because I can always take it off. It's a lot harder. It's a lot easier to take off than it is to add it. So I'm going to go ahead and throw 10,000 of cancer. And the way I'm going to tackle this is Mr. and Mrs. or Mrs. So-and-so. My package, in fact, now I'm going to put it together. Okay, I know I'm 25, and then I know that this totals 22. So that's what, $47. So Mr. and Mrs. So-and-so, for $47, here's what I'm going to do. I'm going to get your health insurance. Okay, I'm going to cover you. I'm going to go over all the details on the health insurance. And then I'm going to do a separate plan that is going to give you money to pay that $675. And then upon diagnosis of cancer, we're going to drop $10,000 into your account. This is your money. This is the money that you're going to use to potentially stay home after your treatments, use for some experimental drugs that you may want to do, a recovery trip, or just stay home for a couple of months to recover. How nice it would be to have that extra $10,000 so that you don't have to go to work the next day. So I'm now quoting $47. Okay, FYI, this is how you issue it. And where they say yes, here's what you do. Apply now. Here are the health questions. Okay, I literally ask these word for word. If you answer yes to any of these, it's not going to go through. So just ask them. Go through these questions. Okay, so it's a 2-year look back for all the questions in section 1. It is a 12-month look back for questions in section 2. 3 is also 12 months. And then the cancer is 5 years. If you answer no to all these, you go to the next section. You can be done with this in less than 5 minutes. You'll enter their information, gender, you put the socials, or whatever the socials. You put the address. I guess I got to match them to move to the next screen. Okay. Put their information. Choose an email address. You continue. Are they on Medicaid? Are they replacing any coverage? Do they have a household resident who's resided in the house and is 18 years or older? You'll go over the coverages one more time. Here's the billing. Now, there is a one-time $25 application fee. So I'll request the effective date. We can go to 2020 or January 2020. Select the mode. We either draft now or draft on the date, on the initial premium date. But when do we want that to happen? What date of the month do they want draft? After the first one, checking account, put their information in here. Now, once you've done all that, you're going to get to, you do an agreement. They'll ask you some questions. And then there is the signature. You'll have the ability, if they're in front of you, to do DocuSign. If they are not in front of you, you'll enter an email and you'll send it to them. And then they can DocuSign. There is just one signature. And it's fairly easy to do. After you've issued your hospital indemnity, you can go over here and pick your plan. You're going to add it to the cart. Start the application. Now, I have been telling people, well, you know what? Here's a problem. We're not November the 1st yet. Okay, so we're going to go change this up so you can see the procedure. If we were November the 1st, you're going to go you're going to see this screen. Now, I have been telling everybody, go here and do this process. Well, yesterday I processed one, and I did it over here. And it was super simple. I mean, we were done in less than 5 minutes. And that's because I was showing another agent how to do it. So technically on this side, and I didn't know this, but it will sync automatically with healthcare.gov. And you'll get your letter, your eligibility letter, so you can figure out what items you might need to upload. You'll get the subsidies. I mean, it is incredibly easy. So when the first one starts, do it over here. I even went back in yesterday to go double check to make sure my agent number was in there. And it was. And the main reason that it was in there was because over here, when I opened up my app, it has my name and my NPN. And it filled it in for me. And I was surprised at how easy it is. So you can go the old way or you can go the new way. Either way, it is the same. So you kind of pick which way works for you. I hope this helps. I will keep you posted on any updates. Hit me back with any questions.